hear from CTAA on the results of their study on how transit proved to be a part of the community response. In addition, we will have the opportunity to hear about the 6 recommendations leveraging coming out of this study to leverage these partnerships and flexibility into the future. So first, I'd like to welcome the MPTA board members who are here with us this morning. I know that you're out in our cyber audience, so we want to thank you for your leadership in Missouri on public transit and your commitment to the MPTA. Second, thank you to the CTAA and Taylor Clockey, who is joining us today, as well as the author of this study, Stuart Mader. So now I'd like to give you a quick bio on each of our presenters, and then I'm going to turn it over to them for the bulk of this program. As a reminder, please place all your questions in the chat box. We will most definitely get to them. And before I forget, I also want to let you know that we have a really special guest. Stuart's friend Maurice is joining us as well. I'm told that he handles the mouse for all of this. So, you know, this whole cat and mouse game is going to be great for our presentation this morning. I'm just trying to keep everyone on their toes. So thank you for joining us again. Taylor Clockey is with CTAA. She's the Senior Communications, Events, and Legislative Specialist. Taylor works closely with CTAA leadership to research, write, and design content for the association. She regularly meets with CTAA members to learn more about their policy needs and translate that to Congress. And also special thanks to Taylor, who is helping us set up meetings with our Missouri congressional delegation. So welcome, Taylor, and thank you. We'd also like to welcome Stuart Mader. Stuart works with transit agencies and policymakers to build better transit, and he is a contributor to numerous media outlets on transit policy. Stuart founded and leads the VAX Transit Initiative with more than 580 agencies in the US and Canada, providing access to COVID-19 vaccines. He previously served as the face of New Jersey Transit, where he streamlined customer communication with new digital and social media tools, improved customer experience with contactless fare payment, and a performance dashboard for 270 million annual passenger trips. So I would like to welcome both of you and Maurice, and I'm going to turn it over to Taylor right now. Thank you.
Thank you so much. Thank you guys for having CTA and me and Stuart. This is something that we are really excited to be here to talk about today. I wanted to give a little bit of background before I kick it over to Stuart about why CTA thought this was a really important piece to produce. So as Kim mentioned, we work really closely with Congress to advocate on behalf of community and public transit providers. And when COVID was starting, we got all this emergency relief funding, and Congress was like, great, you got all this money, and now we don't want to give you any more money. And what are you even doing with all this money? And so we thought this report would be a really good way to communicate to the FTA and to Congress about the real stories and the real impacts that the COVID emergency relief funding had on not only communities, but providers as well. My boss, Scott Bogren, one of the things he talks about a lot is that transit's value is not just ridership numbers, it's about the impact in the community. And this report highlights just exactly that. Another thing this report highlights that we have been preaching for years is the importance of partnerships in communities. So the partnerships that were created in response to this pandemic, really need to be continued. And this report highlights that exactly. And one last thing before I kick it over to Stuart, we have a couple webinars coming up on this topic and about overall topics in general, such as the driver shortage. And I'll talk a little bit more briefly about that at the end, but that is coming up. So Stuart, thank you so much. Stuart is the author of this white paper. It's fantastic. I'll link it in the chat just in case anybody hasn't seen it. But yeah, Stuart, all you.
Thanks, Taylor, and thanks, Kim. I'm really glad to be here with everybody. This paper was a thrill to write. Living as we have in the pandemic for the past, I've lost count, is it 18 months? It's been a long time. It feels like it's become kind of our minds have been really, I think, consumed by all of the significant changes of the pandemic era. And I was grateful to CTAA for giving me the ability to go out and talk to agencies around the country. And as Taylor said, profile what they're doing with the funds that were provided. as many of you know, federal funding for transit operations is something that really hasn't existed in the way that it's existed in the last 18 months since really the early 1980s. And there's been a heavy emphasis on the federal side toward funding capital programs. The pandemic changed that. Federal funding for operations became a critical lifeline for agencies of all sizes, with every mission in transit, everything from large urban transit agencies to agencies that provide non-emergency medical transport, ADA, paratransit, and everything from agencies in cities of all sizes to rural agencies and also tribal transit agencies. And this report really reflects that. I talked to leaders, transit leaders all over the country, California, Michigan, Minnesota, Oklahoma, Ohio, and 2 agencies in Missouri. And we'll talk about those, Oats Transit and KCATA, Ride KC. And what I saw in those conversations, what I heard from transit leaders is a really reaffirming commitment to serving their communities. We think of public transit, we think of transit as being very much about mobility, centered on mobility, getting you from point A to point B, buses, trains, paratransit vans, and so forth. But really, I think what the pandemic reminded us anew is that public transit is about serving communities in a variety of ways. And nowhere was that more apparent than the agencies that did some really innovative and different things, both in the early days of the pandemic, before they even had federal funding and knew that they'd have the funding to stay afloat and keep moving through the pandemic, and then continue to do so afterward. And as we jump into the recommendations, I'll talk a little bit about what I heard from some of the agency leaders in terms of looking forward, ways that transit is adapting to the pandemic, and in particular, ways that funding and regulatory changes might help agencies continue to do some of these good things and continue to operate in the same flexible, innovative mindset that the pandemic really compelled. And I think that's one of the silver linings. Before I jump into things, I'll just say, I think that really stood out to me as one of the silver linings of the pandemic. It's certainly been an 18 months, a year and a half that's been characterized by a lot of uncertainty, a lot of concern and fear of the unknown, and a lot of rapidly changing dynamics, and certainly a lot of issues that I think many of us probably never expected to be so much at the forefront of every facet of our lives. And yet, what I think really stands out to me is that the pandemic's given us an opportunity. It's the notion of don't waste a crisis. It's given us an opportunity to change some things that I think we probably all knew before the pandemic were areas we'd love to change, but maybe the structures around us, the sort of status quo, didn't allow for it. And there's nothing like a gigantic world impacting, life-altering crisis to give you some flexibility and some room to, and some compelling reasons to make those changes. So, and that's really what I saw and what I want to share with you. So I want to just give you a couple of examples of some of the things that I saw around the country talking to transit agencies that really stood out. And I'll start in Minnesota with SMART, Southern Minnesota Area Rural Transit. I talked to Kirk Kuchera, who's the executive director of that agency. And what really stood out to me from their adaptation, they partnered with, it was, I guess you could call it a public-private partnership in the community. So they were the biggest employer in the region they serve is Hormel Foods, and Hormel Foods is well known for making Spam. Well, as the pandemic hit and businesses largely had to, in the very early days of the pandemic, shut down for brief periods, and then as essential workers came back in, but in many ways the economy and daily life was very much disrupted. There's a lot of innovative thinking that happened in that area. So, for example, Hormel Foods paid local businesses that normally would serve office workers and folks that are in the community, and we're talking diners, restaurants, small businesses that are very much in the food service industry. They pay those businesses to make hundreds of meals for distribution throughout the community to combat food insecurity. And SMART partnered with Hormel to provide the logistics, essentially to pick up the meals. So the local businesses would make their meals, they would deliver them to the Spam Museum, which was closed because of the pandemic, and SMART's drivers would pick up those meals and then distribute them along with volunteers out into the community to people that might be at risk of food insecurity. And what I like about that example is there's a transit agency that pivoted, and that this is reflected in many of the other agencies that you'll see listed in the report did similar things. Arrowhead Transit up in the Arrowhead, the northeastern Arrowhead sort of pointed region in Minnesota did something very similar. They worked with the USDA Farmers to Families food program. They picked up and distributed food boxes. And what's great about those kinds of examples is what you saw is agencies pivoting to, we serve the community. And on a good day when we don't have a pandemic, that means moving people around. And on a darker day when we've got a pandemic raging and people need to stay apart, that means bringing things to people. It means transporting food. And then back to SMART for a second. In their case, they made some adaptations to service throughout the pandemic. They increased service on some of their routes to cover the increased demand from essential workers who were going to the businesses that were able to be open during the lockdowns. And part of the reason they increased service was to make sure that there was enough room for social distancing. Back in the days before we had the clear guidance that we've had, and particularly I think the clear guidance from DOT, US DOT on masking on transit, and also before we had the vaccines, two of our biggest tools were social distancing and hygiene, washing hands, and so forth. And so for transit agencies, the role to play there in social distancing was to provide more service, so you didn't have packed buses and packed vehicles, and they jumped in and did that. And it shows you the kinds of adjustments that can be made and the kinds of kind of multi-pronged approaches to mitigating the pandemic. And then let me jump over and talk for a minute about going to the south to North Carolina. So as vaccine availability began to ramp up, one of the most interesting examples of a state level approach and really a state DOT approach and State Department of Health too was in North Carolina. So NCDOT, North Carolina Department of Transportation, and the state's Department of Health and Human Services, NCDHHS, they partnered up and they distributed $2.5 million in CARES Act funding to transit agencies throughout North Carolina. There are 100 agencies that operate throughout the state. So their approach was, their top line goal was, we want to make sure that no person has an obstacle in getting to a vaccine. And the role that transit can play in that is carrying people to vaccine locations. And the role that the state DOT and Health and Human Services can play is in making sure that there's funding available to every agency so that the drivers are working, the vehicles are there, people can move to their vaccines, and nobody has to worry about where the dollars are going to come from to make that happen. And they have enabled more than 10,000 people to get vaccines throughout the state with that program, which is just a fantastic testament to coordination at the policy level, at the state level, and how that can flow down and make a difference at the local level. And for many of the agencies in a state like that, small agencies that serve local areas, run on limited budgets, that ability to have resources and peace of mind to provide that service is critical, and it's made a big difference for them. And then jumping over to Ohio, I want to talk just for a second about the Greater Dayton RTA. They started up providing free rides to vaccines using their paratransit fleet. They'd seen a reduction in use of their paratransit fleet during the pandemic. So they activated that fleet first in their approach to getting folks to vaccines, and began to provide free rides in March of 2021. They asked customers to reserve a ride a day in advance using their fleet. And by the end of May, they'd provided more than 900 free trips to vaccines using their demand response fleet. And one of the most interesting outcomes of that work, I talked with Brandon Policiccio, who's their chief customer officer, and he said that one of the benefits for them of collecting information, having people reserve the rides in advance, is they learned something really interesting. More than 50% of the customers that booked a ride to get their vaccine had never used RTA services before. So vaccine transit served as a gateway for people who'd never used their services before. Those people may have used transit before in some way, shape, or form, but they were new to RTA, and providing vaccine access allowed RTA the ability to start building a relationship with those customers. The other thing is they provided 27 trips to groups. So they provided group shuttles where they would coordinate with, for instance, a senior living facility and give people rides to a vaccine location. And they provided 27 of those trips. And that was also an instance where they were reaching people who were new to transit. And they grew from there. So they expanded from their paratransit fleet to using their fixed route buses in mid-March. And they asked customers to simply display proof of a vaccine appointment. Could be a printout, could be email confirmation or text confirmation on your phone as you boarded the bus, to take a free ride to a vaccination location. And they kept it really simple in terms of that protocol. And that was mirrored by just every other agency I talked to followed a very similar approach. That eased the burden on frontline workers and bus drivers. You just look for a vaccine confirmation from a customer and you board. And they even took it a step further than that. In late March, they switched from asking for a vaccine confirmation to simply asking customers to flash the V sign. And that became part of their marketing campaign, flash the V sign, V for vaccine. And when you think about an approach like that, I think what's important about that is they really prioritized conveyance to the vaccine and supporting the community. And they really, in many ways, that's the kind of thing that strengthens community bonds. It builds relationships between, think about frontline workers out there who are not so focused on, obviously, fare collection, because many agencies suspended that, and really focused on making sure that riders know that they can get on, they can get a ride, and they can get the peace of mind that comes with getting the vaccine. And they also added a free weekly vaccine shuttle between their downtown transit center, which is really their big bus hub in downtown Dayton, to vaccination clinics that were operated by Public Health Dayton and Montgomery County. So they also partnered up with their public health department, much like what we saw in North Carolina. And by the end of May, they'd provided more than 10,000 free trips to vaccines on their fixed route buses. And then what's really interesting too is as the approach to vaccination has shifted over the last months, agencies have shifted their approaches too. So RTA, heavy focus on free rides to vaccines using their fleet. But as we got into summer, they began to shift from that approach to getting out into the community. And they inaugurated what they call their mobile vaccine shuttle. So they took a bus, they retrofitted it with essentially to function, and you can see pictures of this in the report. I've got the pictures on my website as well. They retrofitted a bus essentially with space inside it to function as a vaccination clinic. So think counters and cabinets, comfortable chairs that people could sit in, get their vaccine, and then a waiting area in the bus for people to wait 15 minutes to make sure they had no adverse reactions, no allergies. And then head out on their way and vaccinated. And so they shifted to that approach, and over the summer visited dozens of locations throughout the greater Dayton area. And this is a deepening of their partnership with Public Health Dayton and Montgomery County. So the public health staff focused on where are the locations where we need to reach communities, where do we have variations in level of vaccination and target areas. And RTA focused on providing the vehicle, the bus, and the staff, the drivers to operate the bus. And I think what that really illustrates is a blueprint for this kind of work going forward. And in fact, one of the questions that I've encountered in my work on Vax Transit throughout the year, when I've talked to agency leaders, and this was particularly a question that came early on in the pandemic, early on in the vaccination push, I had folks saying, well, one of our, we're a transit agency. I'm a little concerned. If we're going to get out and help with vaccine access, are our staff going to be, giving vaccines? How does this work? And my message was, think of this as a partnership. Your expertise, your area of best knowledge is, how to get around the community, how to get people where they need to go. Your drivers, your frontline staff know the communities, know the neighborhoods, know the people. There's a trust factor in that. If people take transit every day and now transit's going to help them get to a vaccine or bring a vaccine to them, that's a trust factor that really is important, and particularly so in socially vulnerable communities, disadvantaged communities. And then when you partner that up with public health staff, who are the people who are trained to give vaccines, these are the medical professionals. Their need is to know how to reach the right people in the communities, how to get out where they need to go. And so bringing those factors together, the public health staff with the vaccines, transit with the vehicles and community knowledge and ability to get into the communities, and then the communities themselves who need, obviously, these services to either to get to them or to have the services brought to them. It's a great example of how those three things can come together in a really powerful way. And that's something we've seen, I think, in so many good ways over the last year. And then I want to jump now to talk a little bit about Missouri. And I'm going to start with Ride KC, so Kansas City Area Transportation Authority. Much like the other examples I've given, KCATA was involved in vaccine distribution. They initially provided free rides to the stadium where the Kansas City Chiefs football team plays their games. The state of Missouri held a mass vaccination clinic there, and Ride KC helped people get to that location. But I highlighted Ride KC in the report because they did something else that really stood out to me. They partnered with Truman Health System, which is the large hospital medical provider in the Kansas City area, and the Kansas City Public Housing Authority. And what they really wanted to do is make sure that folks, and this was in addition to providing free rides throughout their service area, throughout Kansas City to vaccine clinics. But in addition to that, they wanted to focus on the communities that live in public housing and make sure they're vaccinated. And so what they did is they partnered up with Public Housing Authority and with Truman Health. And here's how the partnership worked. The Public Housing Authority reached out to people in the community, residents in those housing communities, identified people who were in need of vaccines, who their challenge was getting to them, but they wanted to get vaccinated. And then Ride KC provided shuttles they went around several days a week, and they picked people up, took them to Truman Health Systems. They've got 2 big locations that they use, got those people vaccinated, and then brought them back home. And what I liked about that is it's a housing, healthcare, and transit collaboration partnership that very focused on, it grew out of this focus on vaccination in the pandemic. But think about the relationships that creates. You've now got closer relationships in all these examples I'm citing. You've got closer relationships between organizations whose focus is on serving the community in these different and complementary ways. A housing authority that is able to reach its residents and find out who needs vaccinations. A public transit authority that can help make sure people get to the vaccine locations. A health system that's equipped and ready to go with the vaccination clinics and just needs the people to come and get vaccinated. And I think what's exciting about that is to think now about where that goes in the future. What can we do with that as we hopefully, fingers crossed, reach the point where the pandemic is no longer the #1 focus of daily life, and we're able to move beyond that. How do we build on that and look toward the future? And I think that's where, think about these kinds of partnerships and how it could apply to other things. For example, annual flu vaccines, and maybe even COVID vaccines, for example, may become, I don't know, but they may become like the flu vaccine. We may need to get boosters every year. So there may be an opportunity to partner on those things. Certainly with the flu vaccine is something that is a yearly thing. Many people do that. And I think that's an opportunity to think about that focus area. And then let's talk for a minute about OATS Transit. So OATS, I was really impressed the more I learned about OATS Transit in doing this work, because and I think partly for me, one of the reasons this was interesting to me is I worked for New Jersey Transit, which is the statewide transit provider in New Jersey. And I came to learn through doing this work how much OATS really functions as very much a statewide transit provider throughout Missouri. That's something I didn't know all that much about before I talked with Dorothy Yeager, and I really got to know what OATS was doing. They operate in 87 counties throughout the state. In 2019, before the pandemic, they provided a little over 1.4 million trips. And they're a rural transit provider. They serve seniors, they serve people with disabilities, and they also serve people of any age in rural areas. So, obviously complementary to agencies like Metro, St. Louis Metro and KCATA in Kansas City. They're helping people of any age in the rural areas with essential mobility. In fiscal 2020, just to give you a sense of how critical their service is in the pandemic, they provided 1.025 million trips in fiscal 2020. So certainly a drop from 1.4 million, but very impressive to see an organization that, with all the impact of the pandemic hitting them in every direction in terms of needing to put additional protocols in place to disinfect vehicles, as every agency has, ensuring staff were able to stay healthy and get to work and provide those rides. They provided a very significant number of rides throughout the state. And of those trips, they provided more than 2,000 trips for people to get vaccines throughout the service area. And a big piece of that was federal funding. It was funding from FTA. That was something that Dorothy made the point to me to say. Federal funding for OATS was a godsend to have that in the middle of the pandemic to keep them going. And the other thing that impressed me too about was their approach to protocols. So, we've all been focused on things like disinfecting vehicles, obviously wearing masks, encouraging physical social distancing where that's made sense, hand washing, hand sanitizer, all those things. One of the other things that Oates did in their messaging to customers was ask them to do things like, so for instance, customers who ride wheelchairs, to turn their heads away while drivers secured their wheelchairs. And that's a best practice from CTAA for wheelchair securement. It's protection for the driver. If there's a sneeze and your head is turned away, you're less likely to be exposed to droplets. And those kinds of things, that's an example of getting to the attention to detail where that's an intervention from the pandemic, but that's an intervention that can protect the health and safety of drivers throughout flu season, throughout winter, cold, and flu season. So it's that examples like that and details like that remind me of the thoroughness and the depth to which agencies throughout the industry have really committed and recommitted themselves throughout the pandemic to doing everything possible to run good service, to get people where they need to go, and all throughout that process to protect riders and protect drivers. And so I'm going to jump over and talk for a minute about the 6 recommendations that came out of this report. And I want to jump to those, go over those, and certainly leave lots of time for Q&A. So as you're listening, if you have questions you're thinking about, please put them in the chat. We'll delve into them. That's really, I think, where things get exciting.
Stuart, we have
Yes.
one question. I don't know if you want to address it before you move to the recommendations, or if you
Sure.
want to wait till the end.
Let's
So the
take it in
one
now.
question we have so far is that, everything you've said is really great information, but what do you see as the next great challenge in the pandemic as it relates to transit? And this might tie right into your 6 recommendations. We know driver shortage and supply chain, but what else may providers want to be anticipating, or stakeholders in the transit industry? And maybe you can tie it into those 6 recommendations.
Sure, I absolutely can. And that's a great question. Well, the next challenge that I see specifically related to the pandemic is we're going to reach a point where, and I think we're seeing that, where the rate of vaccinations has tapered off from where it was in the spring. It's still continuing, and it varies kind of regionally. But I'm looking at this and thinking ahead. Maybe it's 3 months, maybe it's 6 months, maybe it's 9 months, to a point where we've got some portion of the population who's, my hope is that what we have is everybody vaccinated or close to it. But the reality is we're going to have some people who aren't. For various reasons, and some of those are legitimate. Some people have medical reasons. I have a friend whose mother is, she's thankfully in remission from a rare cancer, but one of the side effects of her medication is the vaccine. She's been vaccinated and did not develop antibodies. So there's challenges like that are out there that we've got to think about. And there's also certainly challenges with a segment of the population who may opt not to get vaccinated. And I think the question really for transit providers going forward is how to handle that. And there's going to be various, I think, elements in that. One thing that was interesting to me, it was notable as a unique example of a transit agency taking a kind of an unorthodox approach early on in the pandemic. In Indiana, the NCTD, Northern Indiana, NICTD, Northern Indiana Transit District, they had some conflict with riders who were wearing their masks and riders who weren't. And the approach they took was to designate a car on their trains for people that opted not to wear masks, and ask people who were not going to wear masks to move into that car as opposed to riding in other cars on the train. When the federal mask mandate went into effect, that became a moot point for them because they now had the backing of the federal government and regulations from DOT and TSA. But what was interesting about that to me is that they had to take really they had to come up with an approach when they were kind of on their own to figure out what to do. And there was some conflict around that. There was some media coverage of it that was critical and kind of questioned why they were doing it. And what was interesting to me is the media reports that I read, it was largely in the Chicago media. The reporters sort of took the critical approach of this, and then every customer they talked to validated the approach and said, well, look, I feel more comfortable knowing that they're taking an approach. They're doing something. They're not leaving us in a position where, hey, as a customer, what do I do? And so I tell that story because not so much for the specifics of what they did, but for the strategic approach that I think every agency can really adopt and use and kind of use as a lens for your thinking, which is no matter what the specific instance is, the specific dynamic that we have to deal with going forward, think through the lens of relentlessly protecting your customers. What decision do you make? Think of it this way: whatever decision you make, will a customer tell their fellow customers, their families and friends, a reporter if they're asked, I don't like that decision, I wish the agency had done something different, or I totally understand why they made that decision and I support it? And I think if you can do that, and it's going to be a challenge, and I think every decision has some challenges to it, but I think if you can think through that lens of, are you doing something that you know you can articulate it's in the best interest of customers, and most importantly, that customers will naturally articulate that, that'll serve you well. And that'll serve you well no matter what the specific dynamic, what the specific kind of curveball that the pandemic throws at us is. And then to get into the recommendations, and that I think kind of that sentiment is something that I think is a through line through all of these recommendations. So the first one is to make public health a new focus area for transit. And that's really important because historically, one of the natural big focus areas for transit has been commutes. In fact, we see it in the name of commuter rail. It's in many ways, it permeates the language that we use as transit agencies, metropolitan planning organizations, DOTs. The word commute and the sort of orientation around getting people to and from work as an essential function of transit is there. It's self-evident. And part of that is history. When you go back and you look at the formation of lots of public transit agencies and authorities, particularly those that were founded in the late 60s into the mid 70s, correlating with the time when private railroads and private bus companies, a number of them were facing financial distress, and we went from essentially having those private providers to public authorities. The public authorities really assumed responsibility. They were created to sustain commute-oriented transit. And that's why the word commuting is in there. But here we are 5 decades later, and the pandemic has changed that. The pandemic has really brought into stark relief some of the inequities in society between services that largely served people who were going into and out of city centers for white collar jobs. A lot of those people have been able to work remotely, work from home, work in arrangements that are not 5 days a week, going into the office and back home. There's some silver linings to that. I can tell you from working on frontline customer experience for the third largest transit provider in the country, and an agency whose service very much kind of everything, so to speak, kind of aligns around service into and out of 2 major cities, New York and Philadelphia. If you have a problem in the tunnels or bridges into either of those cities, that can manifest itself in a terrible commuting experience. So silver lining of the pandemic is if we don't have sort of the peak of the peak loads of people going in around the 9 and 5 hours, you don't quite have that same risk that one disabled train or one signal malfunction can wreak havoc on tens of thousands of people. But you also have the challenge of, well, what do we do now if we've got far fewer riders who are riding around those time points, around those sort of traditional times, so to speak? And going right to what I shared about the partnerships around vaccination and healthcare, it's clear to me that there's a lot of opportunity for transit agencies to deepen those partnerships with public health and to focus on health as a focus area for transit. And that means better service getting people to and from doctor's appointments, getting people to and from vaccinations, immunizations, I took the bus yesterday to, my younger daughter had a cold over the weekend, and we did an at-home COVID test. Thankfully, it was negative, but for her to go back to school, she had to get a PCR test. She had to go to her doctor and get a test. We jumped on the bus and did that. We did that in the middle of the afternoon yesterday. Transit during the day, more balanced service throughout all hours of the day is one of the ways that transit can better focus on healthcare as a focus area. If I go to the doctor in the middle of the afternoon and I've got frequent bus service, that's great. That makes it easier for me to take transit versus some other mode of mobility. And so I think that's, as I say, that's an area that I think is really important to focus on. And when you delve into some of the regulatory and kind of logistical challenges around that, I'll give you an example. When I talked to Brandon Policicio at Dayton RTA, one of the challenges that he brought up to me was that when you think about it, there's the sources of funding that go into transit, particularly around healthcare related, Medicaid, transportation, NEMT, and so forth. There's more than 70 existing programs across various federal agencies that provide that money. And this is not a criticism. This is really an opportunity, I think, to level up on that. Can those programs that are distributed across 70 plus programs across different federal agencies, I see an opportunity for stronger coordination there, to look at those programs and say, is there duplication in the way things are done? Or is there funding that might be going more to private transit providers, private contractors, maybe private contractor that a hospital contracts to provide NEMT? Should we look at moving the direction on that and saying that funding really should go more toward the local and regional public transit providers? And should there be more of a sort of focus on that? Because that focuses resources into public transit agencies. It allows for greater quality and frequency of service on public transit, which can serve people if they're going for medical related trips, and it also has the ancillary benefit of serving other people who are going to use transit for other needs. So there's, at the policy level, there's a real opportunity, I think. It's exposed, I think, and brought that into stark relief to look at things like that. And also I think what it means is an opportunity to improve those things, to streamline, to level up. Jumping away from sort of the medical focus for a minute and talking on the financial side, more equitable and fair payment is a really big one. And several of the agencies I talked to leveraged providing vaccine transit to also introduce customers to new forms of fair payment and new fair payment systems. So, for example, Monterey Salinas Transit, which is south of the San Francisco Bay Area, they serve a large area. They've got kind of a very diverse customer base. And they have traditionally been reliant on, like many agencies, on kind of their own fare system, but they're moving to a brand new fare payment system. In fact, they're the first agency in the state of California to introduce an open loop contactless fare payment system. Open loop meaning you don't need an agency fare card that you load with money to pay fare. You can use a debit or credit card that you've already got in your wallet and tap that on their buses to pay your fare. The system also includes things like having a card for people that are unbanked or don't use digital devices. And this is part of something that's at the California DOT. They've got this program called CAL-ITP, the California Integrated Travel Project, which I think is a really interesting example to look at. They're essentially, what CAL-ITP is doing is building through their DOT a fare payment platform that any agency in the state can opt into and use. Really smart use of resources, because it's taking the burden off of individual agencies of developing new fare payment systems and creating an open standard. And it's also, it creates opportunities to improve access to transit and kind of the logistics of it. An example of that is, so when I talked to Carl Sador, who's the CEO at Monterey Salinas Transit, he gave me an example where using the new fare payment system actually gives customers more ability, more options on the existing system without them even changing service. It just gives customers more options. How does it do that? Well, under their existing fare structure, they've got a $1.50 fare that you pay for a short trip, and then a $2.50 fare for a longer trip, and then I think it's like a $5, something like that, fare for their longest route. So it's kind of based on distance. And on the old system, you could, if you were going on a short trip and you were paying the $1.50 fare, you could only board a bus that was running on one of the shorter routes, which meant if another bus came by that was a long distance bus, if you were only paying the sort of short trip fare, you couldn't board that bus. Now, under the new system, where they're using this electronic fare payment system and they're doing the open system, you can board any of the buses, and you can pay for the trip you're taking because you tap in, tap out. And now you're paying that shorter fare. You're taking the same shorter trip, but instead of having to wait maybe 20 minutes between the buses that run on that short route, you can hop on the bus that comes in between those two, 10 minutes, and take that one. So those kinds of opportunities come up as we look at improving fare payment. And what I love about that as an example is they didn't have to change their service structure. Their fare structure simply enabled riders to use more of their service, to have access to more frequent service. And then one of the other things that's really interesting about their approach is California DMV is also involved in this project because DMV, so California DMV maintains the state's registry of status for customers that have eligibility for discounted fares, for discounted or different products. For example, veterans, seniors, people with disabilities. And before this whole Cal ITP project came about and MST opted in, an agency like MST would essentially have to, if somebody is applying for a reduced fare card, disability, senior, veteran, they would need to fill out paperwork with the agency. The agency would need to dedicate resources to verifying their eligibility, issuing a special fare product to them. What's really beneficial to MST is they're going to be able to tap into the existing registry of all that information that California DMV has. So if a customer comes to them and identifies as, let's say, a veteran, MST is not going to need to collect information from that customer, get an application from that customer, process that by themselves. They're going to be able to look up that customer in DMV's database, see that that customer is a veteran, and flag that customer's account in their payment system to pay the reduced fare. And now that customer pays the reduced fare. And what is even cooler about it is with this open loop system, the customer's existing credit or debit card that has their name on it, their name registered with the account, can be linked to that. So they don't need to go get a special senior fare card. They're going to be able to pay the senior or veteran fare card with their existing debit card without having to go through a long application process because the data already is there. This is an example of agencies, public sector government agencies really linking up and sharing data and using it to improve the experience. And so I think, to me, opportunities like that are, I think, something that coming out of the pandemic the environment is ripe for more of that. And I'll end on that recommendation with something that Carl Sidorik at MST said to me, which I think really sums up this whole approach. He said, customers don't need 3 different cards to buy coffee in San Francisco, San Diego, and Monterey. So why should they need 3 different payment methods to ride transit in those 3 cities? That perfectly encapsulates why that's such an important focus area. And then jumping to, we touched on this a little bit, but recommendation 3 is really around federal and state support. So focusing that support on frequent, reliable service. Now, $69.5 billion have gone into transit between the CARES Act in March of 2020, CRSA in December of 2020, and then the American Rescue Plan in March of this year. And as I mentioned early on, that's a real milestone in transit funding because that funding it's federal dollars focused on transit operations, which means focused on service, providing frequent, reliable service, doing it through the pandemic. And one of the other interesting things about that is those federal dollars have not required a local match. And that's something that's really opened up some, again, as with all these things, it's opened up some opportunities for agencies who might otherwise not have the funds in the pandemic. Now, that as I talked to agency leaders, the views on that were kind of varied. Some folks thought that not continuing to provide federal funding, but without the local match, especially for really small rural transit providers, created some flexibility in terms of being able to do things like focusing dollars on fleet replacement and then using the federal dollars to provide more frequent service. Other folks looked at it and said, well, I think having some level of a local match, maybe it's a lower local match than what we've had in the past. It ensures that people have skin in the game, but maybe having some flexibility on that would be good going forward. So I think that one, there's a little bit more of a variation, but I think the general sentiment is, the general feeling among everybody is, transit, our industry would not be where it is today, but for the infusion of federal dollars into transit operations throughout the pandemic. And the opportunity really thinking ahead from that is how can we make the most of the dollars that we have right now, for as long as our agencies have them, to provide really good service, because that does something important. It shows that the federal investment in transit has been a worthwhile and prudent use of public funds. It also sets the stage to have a really, I think, productive conversation at both federal and state level around funding in the years to come, which is, hey, if we were able to take those dollars, use them well throughout a period of essentially national emergency, what could we do with ongoing a greater level of support for transit operations when we're not living through a period of pandemic emergency? I think that's a really compelling conversation to have, and backed with examples like what's in the paper I wrote for CTAA. I think it allows that conversation to be really productive at the legislative level, at the policy level, and both at the federal and state level. So I think that's why I focused on that as a recommendation for agencies to be thinking, again, every decision you make around service, around what you do with the dollars that you have, think about it through the lens of how is this going to strengthen our ability to make the argument for the continuation of these funds, for continuation of this focus on operating support in the years to come. That's going to be really critical. And then
So
recommendation.
Stuart, we do have a question on that recommendation. Sure. So how do transit systems use future infrastructure funding if it passes when transit trends are in flux due to increased telework and possible shift to auto use? And then a little on top of that, and due to changing transit trends, it seems to be not the greatest timing of infrastructure funding for transit systems. Do you have a response to that based on your last recommendation?
I do. I do. So yes, we're in flux. We've been in flux for 18 months, and we're gonna continue to be in flux for at least the next 18 months. That's just flux is. I feel like I'm in Back to the Future right now talking, because I'm going to say flux is the future. I think we all have to realize that we're going to continue to live in that environment. And so with that as context, here are two thoughts on that. One is the infrastructure funding that is the subject of the big bills that are being talked about in Congress. The argument for that funding is strengthened by everything that agencies are doing with the funding that's been provided, with the operations focused funding that came earlier on in the pandemic. And I think that the argument for transit is strengthened for that kind of funding to continue, to see for these big bills that are being talked about to pass and to provide resources. The argument strengthened by prudent use of the funding that's been provided. And think of it this way: if we're not sure what infrastructure we're going to need because we don't know exactly what travel patterns are going to look like, then the very best thing we can do is take operating funds and focus on making every improvement we possibly can to the experience for people who are riding right now, and for people who may try transit, we may be able to entice to transit. So think of it this way: running more frequent service makes transit more attractive as an option, as a mobility option. And it ensures that if somebody is concerned about not wanting to be on a packed bus or train, now the reality is if you're vaccinated, the guidance is pretty clear across the CDC, World Health Organization. There's pretty good alignment that if you're vaccinated, you don't really need to be 6 feet apart. So the notion of the sort of medical or public health need of that is diminished. But there's a perception value. Some people feel comfortable not being on a packed or crowded vehicle. So running more frequent service gives people that peace of mind. But equally, or maybe even more importantly, running frequent service gives people the option to look at it and say, yeah, I can take the bus to get there, and it's going to take me 15 minutes on the bus, but it might take me 20 minutes in the car because there might be congestion or what have you. I'm going to take the bus. So I think we've got to be thinking in that mode. And I'm not here to say cars are bad and transit is good and it's a binary. I'm here to say the more we can entice people to take transit and use it and sort of not opt for the car by default, the better off we are for everything from the day-to-day operational health of transit agencies to reducing greenhouse gas emissions and protecting the environment. So that's why I say to think in these ways around frequency of service. Another example I can give you to think about sort of in this environment where, again, infrastructure feels like it's in flux, but service is something that we know we can control. One thing that I'm observing, and I've been watching this, really since the beginning of the pandemic, and I'm especially watching it right now this fall, is transit agencies that had gone fare free early on in the pandemic for sort of hygiene and health reasons. We don't want to have exchange of money. We want to be able to maintain distance between drivers and riders and so forth. And the federal dollars allowed them to do that. I'm tracking the agencies that are now continuing to do that. In fact, where I am here, I'm in suburban Washington, D.C., Montgomery County, Maryland. Montgomery County's countywide transit service had suspended its fares early on in the pandemic, and they were due to resume fare collection earlier in the summer. They extended that until the end of September, and then they just announced last week that they're extending that until the end of the year, until January 1st, 2022. And what I see in that, and that's just one example, but lots of agencies have done that, have continued to extend their fare-free transit. And I think what's interesting about that is I'm keenly interested in whether that reduces a potential barrier or obstacle for people to take transit. If you can hop on the bus and you don't have to pay a fare, does that contribute to transit being a more attractive option for people? I know that for me, and this is an anecdotal example, it certainly does. I have two daughters, 8-year-old and 4-year-old. I drop my 8-year-old off at her school bus, and then I go and I take the local bus to my younger daughter's preschool, which is in the opposite direction. The fact that the bus is fare free is an added enticement for me to use transit, because we just jump on the bus. I don't have to worry about, do I need to pay a fare for her? What age is she? What's the policy on kids riding and so forth? And in fact, the county here is in the midst of a study that looks at the potential for going fare free for transit. And one of the most interesting findings in that is that it would, the most significant increase in use of transit would be with the option where the agency would go fare free. And again, I'm using that as an anecdote. I'm not advocating for one way or the other, but what I'm saying is that's an area to focus on and look at. Not every agency may ultimately go fully fare free, but there may be opportunities to look at it, say means-based. Maybe we're going to go fare free for people at a certain income level, or folks, fare free for kids to go to school, for example. So I think that's an area to look at and say, what are the benefits in terms of drawing more people to transit? Because I think that no matter what the uncertainty is around the fixed elements of infrastructure, the concrete and steel, as it were, what we know we can control right now is the frequency and the quality and reliability of service to the degree that we can, and the ability to draw people to transit. And I think that as the infrastructure negotiations continue to move along, as the questions around use of transit continue, what I want is industry to be in a position where, however people are looking at that, and from whatever angle they're looking at that, what they see is transit that is recovering from the pandemic, that is picking up new riders, that is serving people kind of in for a wider variety of types of trips at all hours of the day. I think that if we show that, then we're going to be in a pretty good position to kind of take whatever curveballs come our way in terms of things in the future, whether it's dynamics from the pandemic or whether it's dynamics from kind of the legislative and policy twists and turns on infrastructure. I hope that's helpful. And one other one to stay on that line of things that are in our control. The fourth recommendation I have in here is around strengthening hiring and career development. And this gets to the question that came up earlier around one of the challenges that's certainly been a growing and I think acute challenge for providers around the country is driver availability. It's staffing issues and staffing shortages. And certainly a number of agencies around the country have had to make yet more adaptations and adjustments to service because of staffing shortages. And so there's two ways I think going forward to think about that. One is, and it goes back to that idea about, are you making decisions that you can articulate to your customers are done with them in mind, and customers sort of in turn can articulate amongst themselves. And one of those is if you have to adjust service on a route and you have to, let's say, go from 20-minute service to 30-minute service for a period of time because you've got a staffing shortage, be upfront about that with your customers. Tell them why. I think it's easier for people to criticize any organization from which they're a customer, but particularly agencies in the public sector, government, so forth. It's easy for people to criticize when there's opacity, when they don't know why decisions are being made. It's also easy for people who have an agenda to jump in and fill the void and tell a story about you that's not true. It's easy for them to jump in and say, oh, these people don't care about you. They don't want to run service for you. They're goofing around with your public service. That is often not the case. It is all too often the case that we're dealing with tight budgets and limitations that are imposed, kind of external limitations on what we can do. And we've got to work through those. Tell your customers, explain to customers where you're coming from, and you're helping your customers have that much more reason to say, hey, I understand it's inconvenient that the bus is running a little less frequently, but hey, if I know it's only going to be happening for say 8 weeks, and then you're planning to go back to more frequent service, I'm going to be able to handle that all that much better than if I think, oh, you're just using this as, for example, sometimes when there have been service adjustments, the bad actors, so to speak, the folks that have an agenda will jump in and go, oh, they're using this as an excuse to cut your transit service. Well, if you're out there telling customers, no, this isn't an excuse to cut your service. This is an acute staff shortage we're facing. We've got X number of new people in training. We plan to have them out on the road in 6 weeks, and therefore we're going to be able to, bring service frequency back up as soon as they're trained and certified and back out on the road. If you're communicating that way, you are closing that gap. You're making sure there isn't a void that somebody can fill with disinformation, and you're building a closer relationship with your customers. So that's the comm side of it. The human resources side of it is couple your messaging to customers. So if you're in a situation where you've got to tell customers that you need to temporarily cut service because you're having a staffing shortage, couple that message to customers with messaging about hiring and about if you're doing it, tell customers about that. If you are facing a need, you're looking to hire, say, we need 30 new bus drivers. Tell people, hey, we need to cut service for the next few weeks because we're facing a shortage, but we can fix that if we can hire 30 new bus drivers. So tell a friend. Because now you're activating people, you're converting somebody from a critic to an advocate. Now that person can go out and say, hey, do I know anybody in my network? And these days people likely do know somebody in their network who might have a CDL, might have worked or be working in, let's say, package delivery. We can draw those people over to work in public service, to work in transit and do that. And I happen to think it's a far more fulfilling job to be out there working, transporting people to the grocery store and doctor's appointments, school and work and all those things. There's a message there. So
Stuart,
now you
I'm gonna.
can.
Oh, sorry. I was just gonna jump in one
to show
moment. We
people
only
what you're doing.
I think we actually lost Stuart. So I know that there was one more question for him, and Taylor, I'm not sure if you want to jump in or not. But would you say the new best practices that are outlined in this report were actually best practices all along, some of these practices?
Definitely. And I think that the pandemic just gave operators, a new opportunity to re-implement them and continue on providing, bigger and better service.
Okay, great. So I think that Stuart is attempting to connect back on. I know that we are at the hour mark. So if there are any questions that anyone has, if final questions they'd like to ask, if they want to put those in the chat box. Otherwise, Stuart, I wanted to thank you for your time today and all this information that you provided. Taylor graciously shared the link to your report in the chat box, and we'll also be doing a recap on the website with the link to the report as well. I didn't know, Taylor or Stuart, if there are any final thoughts that you want to leave with all of the attendees today, maybe one takeaway. We like to say a quick snapshot, a quick takeaway of what you think is really important about this report or what they should be thinking about.
Stuart, you go ahead.
Sure. The most important thing is we're in a moment where flux and change is our reality. The notion of, I often hear people use the notion of when are we going to go back to normal? I don't think we're ever going to go back to what normal looked like before the pandemic. We're in a new era. And the exciting thing about the new era is we can do things differently than we did them before. The status quo isn't the status quo anymore. That at times can feel scary. It can feel unsettling. It can feel like we're kind of navigating in the dark. But the advantage of that is we can rebuild things in ways that serve our communities better and we can unlock and do some of the things we wanted to do for a long time, but the conditions weren't right for it. Think of it this way, the conditions are right for it now.
Okay, great. Thank you, Stuart. Taylor, any final thoughts?
Couldn't have said it better myself, Stuart. We really are encouraging agencies to use this opportunity of change to just keep on going, see how you can adapt to continue to serve the changing needs of your communities. Before I close off, I just wanted to share a quick link with you guys. I just put it in the chat box. We are holding a webinar on, it's not even a webinar, it's a meeting now on October 7th about the driver shortage. So we're going to be joined by 2 rural operators who have really interesting ideas about how we can kind of find solutions in this. And our goal is to really come up with actionable solutions that will help agencies across the country. So definitely make sure you attend that.
Thank you, Taylor. Thank you, Taylor and Stuart. Stuart, I have to say that I think my favorite quote from you is that the silver lining of the pandemic is that we're given this opportunity right now to change some things that maybe needed to be changed or were the status quo, but we couldn't do it. And now we can because of the pandemic. And I think that that's a real opportunity for public transit and Missouri transit providers. So I want to thank you both for your time today and sharing all of this information. And we will be sharing it with those who could not join us. We really appreciate your support. And Taylor, we have already let all of our providers in Missouri know about the meeting on Thursday about hiring. And I do agree with Stuart, the more transparent our agencies can be about the openings for jobs, for operators, good paying jobs, we need to share that far and wide. So thank you very much. Thank you for everyone who has joined us on the webinar today. Please check out the website for additional information about the education series and other opportunities that we're offering at mopublictransit.org. And everyone have a great day. Stay safe. Thank you.